surgery known as dilatation and evacuation or dilatation and curettage. Has anybody heard of the term dilatation and evacuation? What is dilatation and evacuation? Enlarging what? Dilating the cervix and evacuating the products that are inside the uterus. That is the surgery we do. That is called dilatation and evacuation. Curettage কি জিনিস আমরা বলবো? Curettage is C-U-R-E-T-T-A-G-E. Curettage, huh? You're scraping out the products. Curate মানে scrape out করা। দেওয়ালের মধ্যে স্যান্ডপেপার দিয়ে ঘষা দেখেছিস? সেরকমই ইউট্রাসের ওয়ালটাকে যখন আমরা ঘষে ঘষে কিছু প্রোডাক্টস বের করে নিয়ে আসবো, দ্যাট ইজ কল্ড এ curettage. আর evacuation মানে products are hanging by something, you're holding the products and taking it out. That is called evacuation. You understand the meaning of the English word evacuation? Is simple meaning. বের করে নিয়ে আসা evacuation. So those are the two surgeries that we are going to talk about today and the instruments that are needed for the same. Okay. I'm taking all the instruments in একটা করে. We're going to talk about the instruments and then the operation. Serially সাজানো আছে, ঠিক আছে? The instruments that we are going to require for doing this surgery. We're going to talk about the names first. What is this? Sorry? Bolo? Sponge holding forceps. Very good. This is a sponge holding forceps. Look at the instrument. This comes in a larger size also. This is a 4-inch one. There comes in a 6-inch one also. It has an olive pointed tip with serrations on the tip. Tipper মধ্যে serrations কাটা আছে, ঠিক আছে? We have a catch. This is called a catch. Any instrument that you are going to see, any finger instrument has 2 to 3 parts. A limb, a joint, a body and a finger rings বলা হয়, ঠিক আছে? And কিছুতে catch থাকবে, কিছুতে catch থাকবে না. This is called a catch or a ratchet. This helps in better grip of the tissue or better grip of the whatever product we are holding with this. This is a catch. It locks it in place. This tip has a serration. সবকটা লিম্বের মধ্যে serration করা আছে for better grip of sponges. Sponge holding forceps মানে this is used to hold sponge or gauze piece for draping and dressing. মানে যে এরিয়াতে আমরা অপারেশন করব সেই এরিয়াটাকে অ্যান্টিসেপটিক ড্রেসিং এন্ড ড্রেপিং পরিষ্কার করার জন্য we use betadine solution for 10% betadine solution for cleaning the area, local area, সেটা পেরিনিয়াম হোক, সেটা অ্যাবডোমেন হোক, যেখানেই ওটি করব আমরা, we are going to use that for cleaning. This is used to hold the sponge. এর ভিতরে কষ্টটা ধরে this is how you drape it. Okay, this is called a sponge holding forceps. এটা আগের দিন পড়ানো হয়েছে. What is this? একটা বড় নাম আছে, you have a bigger name.
Double-bladed, metallic, non-self-retaining.
আর কিছু? Since double-bladed মানে it has 2 areas, 2 blades, double-bladed, metallic because it's made of metal, non-self-retaining because you need an assistant to hold this posterior vaginal speculum. Okay, so you know about this, right? The second instrument. The third instrument that we require is this one. Any idea what this is? Sorry? No, there is no such thing as ovary forceps. In gynecology, there is no such thing as ovary forceps. What is this? This is called an Allis Tissue Forceps. A-L-L-I-S. Allis Tissue Forceps. Huh? What is the speciality of this? Again, this has 2 limbs, body or shaft, finger rings, catch. The difference is in the head. আগেরটার মাথায় কি ছিল? It was a sponge holding. আগেরটার মাথাতে কি ছিল? Broad area ছিল, serrations ছিল. এটা কি আছে? দাঁত আছে. It has tooth in its head. There are 3 to 4 teeth for tougher grip on structures. স্ট্রাকচার গুলোকে ভালো করে টাফ গ্রিপ করার জন্য আছে. Any problem? Okay. If you cannot see, you can come on this side. You have to look at the instruments. You are welcome to come on this side. This is an Allis Tissue Forceps. Okay. Same. Again, a smaller version of the same. Another Allis Tissue Forceps. It are long, it are short. একই রকম. Look at the teeth. Both have same kind of teeth. This is what you need to see, the tooth, okay? Allis Tissue Forceps. This one is known as a multiple tooth Volsellum. Multiple tooth Volsellum. Vulsellum. Volsellum. Volsellum. Vulsellum. Multiple tooth Volsellum. কি আছে? এটা আর এটার মধ্যে ডিফারেন্স কি? নিচের দিকটা সেম আছে, ঠিক আছে? বডি আছে, ক্যাচ আছে, ফিঙ্গার রিংস আছে। Difference in the tooth. See, this has smaller teeth, this has larger teeth. है ना? ছোট ছোট দাঁত আছে, একদম বড় বড় দাঁত আছে এটাতে। This is called a Volsellum. তাহলে tough grip. Okay? দেখতে পাবি? This is a metallic urinary catheter. Metallic urinary catheter, huh? Better. Metallic urinary catheter. This is the portion that goes into the urethra. We have a stylet inside it. এটা ব্লক করা আছে। তুই পেশেন্টের সামনে বসে ঢোকালি, পুরো ইউরিনটা সে তার মুখে পড়বে। We don't want that. So we have a blocking. This is a stylet inside it. We insert this into the urethra. আমরা সরবো, সরে স্টিলেটটা বাইরে বের করবো। বাইরে বের করার পরে ইউরিন বেরিয়ে আসবে। This is for evacuating the bladder. Temporary evacuation of the bladder is done by a metallic urinary catheter. Okay? Body stylet. কোনো সময় যখন ফাইনাল পরীক্ষা দিবি, এই স্টিলেটটাও ইন্ডিভিজুয়ালি অ্যাজ এন ইনস্ট্রুমেন্ট দিতে পারে পরীক্ষার ইয়েতে। You have to know what this is. This is stylet. This is the body. Okay? STELLATE. Stylet. STELLATE. Stylet. Shall I move on to the next instrument? This is called an uterine sound. Uterine sound. ভালো করে দেখ, এটা হচ্ছে ধরার জায়গা। এখানে আমরা ধরবো। This has 3 to 4 multiple serrations on it, যাতে গ্রিপ ভালো হয়। স্মুথ থাকলে স্লিপ করে যাবে। This is for gripping. Okay? This is the part that goes into the uterus. This has numbering. See, 1, 2, 3 করে numbering করা আছে। This measures the length. এটা একটা রুলারের মতো, স্কেলের মতো ইউজ করা হয়, ঠিক আছে? For measuring the length of the uterus. Uterine sound. Okay? This is used to measure the length of the uterus. Not all uteruses will be the same size. আমরা ইভ্যাকুয়েশন করছি একটা প্রোডাক্ট অফ কনসেপশন, মানে প্রেগনেন্সি এসেছিল, প্রেগনেন্সিটা আইদার নষ্ট হয়ে গেছে বা আমরা ভলান্টারিলি পেশেন্ট নষ্ট করতে চাইছি। So we are aiding into that. We are doing a medical termination of pregnancy. In that case, different size of the pregnancy, different age of the pregnancy will have a different size of uterus. 6-week pregnancy will have a different size uterus. 8-week pregnancy will have a larger size uterus. A 12-week pregnancy will have even larger size uterus. তো তোর পেশেন্টের, ইন্ডিভিজুয়াল পেশেন্টের কত সাইজের ইউট্রাস আছে সেটা তোকে জানতে হবে। সেটা না জানলে আমরা যখন ব্লাইন্ডলি ইনস্ট্রুমেন্ট ঢোকাবো, we are going to perforate the uterus if we do not know the length of the uterus. So this is the first instrument used to know the length of the uterus. This is called an, কি বললাম, uterine sound. যা বললাম, there are measurements on it. This is a malleable instrument, so this can bend, smoothly bend হয়ে যাবে, ঠিক আছে? আবার নতুন জায়গায় চলে যাবে, because the uterus does not lie in a straight line. What is the normal position of the uterus? What is the normal position of the uterus? Not exactly 90 degree, close to 90 degree. It is anteverted and both are same. Anteverted and anteverse is the same thing. Anteverted and what is the other term? What is that? Anti-flexed. And the uterus and the cervix. Yes. ঠিক আছে. So anteversion is the angle made by the cervix on the vagina. It is usually 90, not 90 degrees, it is close to 90 degrees because Normal position কি হয়, vagina is a vertical structure. Uterus lies almost horizontal on top of the bladder. Vagina তার সামনে আছে bladder, তার পিছনে আছে rectum. Uterus lies just like this on top of the bladder. This is called as an anteversion. Anteflexion is the uterus makes an angle with the cervix, which is called the anteflexion. Anti মানে সামনের দিকে, retro মানে পিছন দিকে। সামনের দিক মানে ব্লাডারের দিকে থাকবে, এদিকে পড়ে থাকলে অ্যান্টিভার্সন, অ্যান্টিফ্লেকশন, এদিকে পড়ে থাকলে রেট্রোভার্সন। ওকে, so we have to, when we are introducing this sound, we have to change the angle of this. Antiversion হলে কি, এখানে vagina, when the patient is lying supine or in lithotomy position, the vagina is completely horizontal and the uterus is lying on top of it like this. So I have to do an anti-flexion, antiversion, this direction. Okay, so this is a malleable uterine sound. The tip is not sharp. It is called olive tip. টিপটাকে পরে ধরে দেখবে, it's not sharp, it's a blunt tip, smooth tip করা আছে, so that the tip does not perforate the fundus. This has been made smooth and rounded so that it does not perforate the fundus of the uterus or the body anywhere in the uterus. This is the uterine sound. তারপর what is this? What is this instrument? This is called a dilator. সেই শুরুতে বললাম আমাদের সার্জারির নাম হচ্ছে ডাইলেটেশন এন্ড ইভ্যাকুয়েশন। দিস ইজ ডাইলেটর। এই ভদ্রলোকের নাম হচ্ছে ডক্টর কেদারনাথ দাস, দাসেস ডাইলেটর, দাসেস ডাইলেটর। ঠিক আছে, এটা মাল্টিপল সাইজে পাওয়া যায়। দিস ইজ দ্য লার্জেস্ট সাইজ। এরকম ছোট 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 অনেকগুলো সাইজ হবে। ঠিক আছে, একদম সরু থেকে শুরু করে আরো মোটা অবধি মাল্টিপল সাইজেস। সাইজগুলো দেখবি এইখানে লেখা থাকে। এখানে কি লেখা আছে? 1/4। এখানে কি লেখা আছে? 13। এই দিকটা একটা ডিফারেন্ট সাইজ, এই দিকটা একটা ডিফারেন্ট সাইজ। both the ends will have different sizes. Okay, we start with 1 2 3 4 এরকম করে সাইজ বাড়বে। ঠিক আছে, total set of 16 dilators are there. Okay, সিরিয়াল ডাইলেটেশন করব আমরা। প্রথমে 1 নম্বর সাইজ দেব, তারপরে 2 নম্বর সাইজ দেব, তারপর 3 নম্বর দেব, এরকম করে সিরিয়ালি আমরা ডাইলেটেশন করব till the size we require for doing our surgery. This is called a Das's dilator. Okay, this instrument, this is known as an ovum holding forceps, not the ovary forceps. There is no such thing as an ovary forceps. This is known as an ovum holding forceps. ঠিক আছে, এটাতে কোনো ক্যাচ নেই। You can see there is no catch in here, right? মাথাতে কি আছে? This is called an olive tip instrument. Olive tip instrument. And this is fenestration in the instrument. ফুটোটাকে বলা হয় ফেনেস্ট্রেশন। যতগুলো ইনস্ট্রুমেন্টের মাথায় ফুটো থাকবে ওটাকে বলা হবে ফেনেস্ট্রেশন। ঠিক আছে, ওভাম হোল্ডিং ফরসেপস কি কাজে লাগে? আচ্ছা, that is the misnomer of this instrument. You cannot hold an ovum with this. What is the normal size of an ovum? You have passed anatomy. What is the normal size of an ovum? You have just passed anatomy. Do you know? Huh? It is around 500 to 600 micron, মানে micrometers. Do you think you can hold that with an instrument this big? No. So this is a misnomer. You cannot hold the ovum with this. এই জন্য কথাটা বললাম, পরীক্ষার সময় কিন্তু বলবে না you hold the ovum with this. Its name is an ovum holding forceps. You cannot hold the ovum with this. It is used for evacuation of the products from inside the uterus. যতটা বাচ্চার প্রোডাক্টস থাকবে, the placental bits, products of conceptions, বাচ্চার পার্ট, মেমব্রেনস যা থাকবে সেগুলোকে ধরবো, ধরে বের করবো। This is used for evacuating the products of conceptors from inside the uterus. The ovum holding forceps. And finally, this is the other name of the operation. This is a curette, a uterine curette. Curette spelling ki? No A, Curette. Curette, ঠিক আছে? This has two ends, huh? One is a blunt end, one is a sharp end. ধর দুটো এন্ডকে হাতে ফিল কর। One of them is a blunt end, টিপগুলো একটা ব্লান্ট আছে, একটা শার্প আছে, হাতে ফিল করতে পারবি। তারপর পাস কর লোকেদেরকে। One of the ends is a blunt end, অন্যটা sharp. You can feel that the sharp might cut your fingers. It is that sharp. Till then, we are going to talk about something a little out of the topic. How do you hold an instrument? Any finger instruments, how do you hold it? দেখা, আমি এতক্ষণ ধরে ধরছিলাম, তুই নোটিস করিস। How do you hold an instrument? তোকে একটা দিচ্ছিলাম, ধর any instrument. Almost there. না, একটা ফিঙ্গার মিস হচ্ছে। না, no, no. Anybody else wants to try? How do you hold an instrument? ও কি ডিফারেন্ট করলো যেটা তোরা করছিলি না? What difference has it done? See, you're going to insert your thumb and your ring finger inside. No other fingers are going to go inside. একটা রিংয়ে থাকবে থাম, আর একটা রিংয়ে থাকবে ring finger. Your middle finger is going to be sitting on top of the ring, and your index finger is going to be as close to the joint as possible. This is the joint. It's going to be as close to the joint as possible. This is the most stable way of holding an instrument. Any instrument with the finger ring, this is how you hold it. And this is how you open it. This will be initial one support, this will be one support. The other two fingers are going to give you support, nothing else. You're going to use your ring finger and your thumb to open and close an instrument. Check. I would need the instruments back along with the curette. Curetteটাকে আমরা কিভাবে ধরবো? In pen holding fashion. Anything that does not have a finger ring, you are going to hold it in a pen holding fashion, like this, in your thumb and your index finger, pen holding fashion. ঠিক আছে? I think some instruments are missing. সব ফেরত চলে এসছে। So, we have done the names of the instruments. We have to know the uses of the instruments. There are other uses of these instruments. ঠিক আছে? First instrument কি বলেছিলাম? Sponge holding forceps. What are the uses of this instrument? Aseptic draping and dressing of a body part. First is. Any other uses? No, not really.
It's used to hold the gauze or something, and it used to braid that if there is in case of bleeding, it is used to push to pressurize the area so that bleeding is
কোথায় লেখা আছে এটা? কে বলেছে? You don't need to go into such detailed description of that. Simple things. Since we are in obstetrics and gynecology class, we are going to talk about the obstetrics part. While pressing on a bleeding vessel, it's okay. You can press on a bleeding vessel by any instrument you want. You can even press on that with your fingers. Any compression on a bleeding is going to stop the bleeding temporarily. You do not need a sponge holding forceps for that. ঠিক আছে? This is used, number one, for dressing and draping. Number two thing that you're going to say is it's used to hold edges of tough structures. This is used for holding the edges of any tough structures before suturing them. And number three, the more important part is this is used in the labor room. In the labor room, this is used. When a vaginal delivery occurs, there may be extensive lacerations or tears on the vagina. You know something like this happens, right? This vaginal delivery, তারপরে tear হয়েছে, bleeding হচ্ছে, traumatic PPH হচ্ছে, right? So there's something called a cervical tear. The lips of the cervix may have been torn while delivering the baby. You have to suture those lips of the cervix. Before suturing, you hold the lips of the cervix by this instrument. You need 4 sets of this instrument, 4 pairs of a sponge holding forceps, 2 on the anterior lip and 2 on the posterior lip. You hold the cervix with this and then you suture. তো আমরা গাইনির পরীক্ষাতে কি কি বলবো? ড্রেসিং ড্রেপিং, holding the lips of the cervix for repairing the cervix after cervical tear, and for holding the edges of tough structures. 3 uses, okay? আচ্ছা, ইনস্ট্রুমেন্টের ইউজের পরে ইনস্ট্রুমেন্টের স্টেরিলাইজেশন জিজ্ঞেস করবে। হাউ ডু ইউ স্টেরিলাইজ দিস ইনস্ট্রুমেন্ট? Autoclave. Any metallic instrument, autoclave. Use of this sponge holding forceps. Same speculum. My bad, sorry. Same speculum. How do you use?
The wall of the cervix.
No. That is the use of Cusco speculum. Keep the distinction very clear. Cuscos is a diagnostic speculum. Whatever you're observing, whatever you're looking at in the outdoor or in the ward, that has been done by a Cusco speculum. That is not an operative speculum. Sim speculum is an operative speculum. This is found in the labor room and the OT. You're going to use it for surgeries. There is no observation in sim speculum. Make that clear, okay? What are the surgeries that you use it for? একটা কি বললাম আমরা এক্ষুনি, dilatation and curettage, dilatation and evacuation for retracting the posterior wall. This is used in vaginal hysterectomies. Vaginal hysterectomies, again for retracting the posterior and the anterior wall. 2 sets of thin speculum is used. It is used for doing a cervical biopsy, endometrial biopsy. It is used for draining pus, hematometra or pyometra. This groove, you can see there is a groove. It's not a straight speculum. There's a groove inside here. Everybody can see it's not a straight speculum. There's a groove in it. This is used for draining the pus or the blood that is coming out. এই গ্রুভের মধ্যে পড়ে ডিরেক্ট ড্রেন করে বাইরে পড়ে যাবে। It's not going to spoil the surgeon or the assistant. Okay? Thin speculum. This is not an observational speculum. You do not observe anything with a thin speculum. Clear? Okay. Allis. Uses of Allis tissue forceps. Surgery পড়েছি সেটা নিশ্চয়ই। Uses of Allis tissue forceps. Allis কি কাজে লাগে? এটা ভাঙা, আচ্ছা তাহলে কতটি খুলছে। Use of Allis tissue forceps. Hold the tissues. What kind of tissues? It's a traumatic tip. This tip is traumatic. দাঁত আছে বললাম আমরা, দাঁত মানে traumatic. ঠিক আছে? Give me the tray once. Not in our set of instruments for D, but I'm going to show you something which is going to help you remember better. What is this instrument called? This is a Babcock's tissue forceps. See the difference between the 2 tips. There is no tooth here. There's a fenestration here. ঠিক আছে? This is a soft structure. I can hold my finger with this. There's no trauma to it. If you try with this, you're going to get yourself cut. So this is used for holding tough structures. Tough structures as in angle of the rectus sheath. While repairing, you're using this to hold the rectus sheath. To hold the anterior lip of the cervix while doing a dilatation and curettage, dilatation and evacuation. You can also hold the uterine angles with this. Okay? Keep it back and keep this also. Not used. Keep the use bollam. Holding the angles of the uterus, holding the rectus sheath angles of the rectus sheath, and holding the anterior lip of the cervix. This was the multiple tooth Volsellum. This is even more traumatic. You can see the teeth are even larger here. So this is more traumatic. This is used for holding only the anterior lip of the cervix, nothing else. The cervix is a very tough structure. This is used to hold the anterior lip of the cervix. কি কাজ বলেছিলাম সাউন্ডের? Length and the angulation of the uterus measure করতে লাগবে. Also, this can be used as a very first dilator. সবচেয়ে পাতলা এটাই আছে, তো this can be used as the first dilator. These are the Das's dilator used for dilating the cervix, serial dilatation of the cervix, for doing dilatation and evacuation or dilatation and curettage. This one is Ovum Forceps for holding the products of conceptions for removal during dilatation and evacuation. Uterine Curette for curating the walls of the uterus. Okay, no other use. আর কোনো কাজে লাগে না, এই দুটোই কাজ আছে. The uses of the instruments are clear. পরীক্ষায় বলতে পারবে ইউজ গুলো কি কাজে লাগে. This initial part of the instruments are multi-purpose use. অনেক জায়গাতে একই রকম ইনস্ট্রুমেন্ট কাজে দেয়, but these are specific instruments. These are not used anywhere else. Only for dilatation, curettage, and dilatation and evacuation. Okay. Next, does anyone know the procedure? Has anyone read on the procedure of dilatation and evacuation? Any idea? Okay. You have time, right? It's only 12. Okay. So let's talk about the procedure first, and then we'll talk about the complications of a D&C surgery. Brains are still sharp, right? We can take more information. Now, I will tell you. Okay. So a patient has come to you. She has a missed abortion or an incomplete abortion. You understand the term of abortion? She had a pregnancy. The pregnancy is lost. Part of the baby has come out. Not a big baby, small pregnancy, 10 weeks, 8 weeks, 10 weeks, 12 weeks. Part of the baby has come out, some other part is still sticking to the uterus. So what happens? She's bleeding. The part that is sticking to the uterus is making her bleed. She's bleeding from the vagina. She has come to you, that is called an incomplete abortion or incomplete miscarriage. The bhalo naam, the better term is miscarriage, not abortion. Okay? Incomplete abortion. Or she has had induced abortion. She has taken some pills in order to destroy the baby, abort the baby. So she has come to an induced abortion. Again, some products are remaining. You have to remove that. That surgery is known as a dilatation and evacuation. So, procedure. Number one, we are going to take the patient to a gynecology OT. Stand in the operation theatre. She is in a lithotomy position. You understand lithotomy? You see lithotomy position? Supine, legs flexed, at the hip joint, at the knee joint. Legs put up on stirrups. Okay? Two stirrups are there, the legs are put up on stirrups. She is in a lithotomy position. Okay? Anesthesia. Definitely you have to give anesthesia before doing surgery. Either it's general anesthesia, short general anesthesia, or we're going to give her local anesthesia. Local mane hoche we're going to give anesthesia on the local part, which is done by a pudendal block, trans-cervical block or pericervical block of the pudendal block. Pudendal block is given. এটা হিস্ট্রি অ্যানাটমিতে একটু পড়িয়েছিল. Where is the pudendal block given? Pudendal শব্দটা মনে পড়ছে? কোন এক সময় অ্যানাটমি হিপ বোনের মধ্যে না, not obturator foramen is in the front. You remember the hip bone? মাথায় আসছে অল্প অল্প করে খেলছে হিপ বোনটা দেখতে. আচ্ছা, there is something called pudendal nerve, artery and vein, PIN, pin structures. Remember? Pin structures মনে পড়ছে? Right. Pin structureটা কোথা দিয়ে পাস করে? গ্রেটার থেকে লেসার. মাঝে কি থাকে? এটা বনি প্রজেকশন বেরোয়, দুটো সায়াটিক মাসকে ডিভাইড করে. কি বলে ওটাকে? What is the bony projection? Ischial spine. Very good. Ischial spine. So we are going to palpate the ischial spine, not on the bone, on the live person. We are going to palpate it per vaginally, and we are going to give the block over there. That is called a pudendal block, because it catches the pudendal nerve, it blocks the pudendal nerve. That is the main supply of the genital organs of the pelvis. We are blocking where? The pudendal nerve on top of the ischial spine. কিছুটা মনে পড়ছে? অ্যাপ্লাইড অ্যানাটমিতে বলেছিল pudendal block দেওয়া হয়, pin structure থাকে. The other kind of anesthesia is a pericervical or transcervical block. Don't need to know that. Anesthesia হয়ে গেল. Next আমরা কি করব? Clean. We are going to clean the area. If it is a general anesthesia, আগে anesthesia তারপরে cleaning. If it is local anesthesia, আগে cleaning তারপরে anesthesia. Simple. পরিষ্কার হয়ে গেল. এই ইনস্ট্রুমেন্টটা ইউজ করলাম, পুরোপুরি বিটাডিন দিয়ে পরিষ্কার করলাম, ক্লিন স্টেরাইল শিট উপরে রাখলাম, ড্রেসিং হয়ে গেল, ড্রেপিং হয়ে গেল, ঠিক আছে? অ্যানেস্থেসিয়া হলো। নেক্সট হচ্ছে we are going to use this in speculum to depress the posterior vaginal wall, and we are going to use this one, Allis or a Volsellum, to hold the anterior lip of the cervix. ধরে একটু টানলাম, টানাতে কি হবে? ইউট্রাসের অ্যাঙ্গুলেশনটা সোজা হলো, যাতে এই রকম কার্ভ করে না ঢুকতে হয়। অ্যাঙ্গুলেশনটা সোজা হলো, একটু সামনে আসবে। ওকে, নেক্সট উই আর গোইং টু ইউজ সিরিয়াল ডাইলেটর্স। তার আগে আমরা ব্লাডারটাকে ইভ্যাকুয়েট করবো। ইফ ইট ইজ নট অলরেডি ইভ্যাকুয়েটেড, উই আর গোইং টু ইভ্যাকুয়েট দ্য ব্লাডার উইথ এ ক্যাথেটার। দেন উই আর গোইং টু ইউজ এ সিরিয়াল ডাইলেটর্স। স্মল সাইজ থেকে আস্তে আস্তে লার্জ সাইজ ডাইলেটর দিয়ে আমরা সার্ভিক্সটাকে ডাইলেট করবো। কতদূর ডাইলেট করবো? যাতে আমার অ্যাডিকুয়েট সাইজ অফ ওভাম ফরসেপস ইন্ট্রোডিউস করতে পারি। এটাও comes in multiple sizes. Depending on how much product you have to evacuate, this comes in multiple sizes. এর থেকেও ছোট মুখ হয়, এত বড় মুখও হয়। কতটা প্রোডাক্ট ভিতরে আছে, কতটা কি আছে সেটা বের করার জন্য অ্যাডিকুয়েট সাইজ অফ ওভাম ফরসেপস থাকবে। সো যাতে আমার ওভাম ফরসেপস ঢুকতে পারে সেরকম ডাইলেশন মানে করতে হবে, ডাইলেটেশন করতে হবে, ঠিক আছে? Then we are going to hold the ovum forceps. See, it's curved upwards. It is curved to maintain the anteversion of the uterus. চলে যাব, hold, twist, come out. Again, go inside, closed mouth. Go inside, open, hold, twist, come out. Drop. Inside, open, hold, twist, come out. This is the procedure of evacuating the uterus. Okay, ovum forceps. Lastly, we are going to use the curette, the blunt curette, not the sharp one. The blunt curette, we are going to hold it in this way. ভিতরে যাব, scrape. We are going to scrape the uterine walls. How many walls are there in the uterus? How can a structure have 3 walls? It's not a triangle. How can it have 3 walls? Don't mug up. Use your brain. How can a structure have 3 walls? It's not a triangle. है ना? Anterior wall, posterior wall, and 2 lateral walls. You have 4 walls of the uterus. है ना? Any sane structure will have 4 walls. Right. So we are going to do scraping on all the 4 walls. Anterior wall, posterior wall, one lateral, another lateral wall. You scrape the walls, take out the products. You're done with your surgery. মোটা মোটা বোঝা গেল কি করছি আমরা। সো এগুলো করতে গিয়ে কি সমস্যা হতে পারে? D&C or D&E করতে গেলে কি কি কমপ্লিকেশন হতে পারে? অপারেশন মানে তার কমপ্লিকেশন আছে। কি কমপ্লিকেশন হতে পারে? ব্লিডিং। ভালো শব্দে কি বলে? ডাক্তারি করতে এসেছি, হোয়াট ইজ আ বেটার টার্ম? hemorrhage. Hemorrhage. You're going to say hemorrhage, not bleeding. Okay. First is hemorrhage. From where? From where? Uterine walls, or from the cervical lip. Either of the two can bleed. Okay. যদি ব্লিডিং হয় তখন তুই কি করবি? ব্লিডিং আটকানোর জন্য আমাদের কাছে কি কি ওষুধ আছে? অ্যান্টিকোয়াগুলেন্ট কি কাজ করে? What is the use of anticoagulant? তাহলে that is not expected from just pharmacology pass করার পরে। coagulant কি হয়? What are the coagulants? Do you know of any coagulant drug? No. তো ফার্মাতে এত বড় এত বছরটা পড়লি একবারে মাথায় আসলো না ব্লিডিং ক্লট আটকানোর জন্য ওষুধ দিচ্ছি তো ব্লিডিং কমানোর জন্য ওষুধ হবে না হওয়া তো উচিত ছিল এটা বেশি দরকার তো তাহলে হোয়াট ইজ দ্য ড্রাগ ফর রিডিউসিং ব্লিডিং অ্যাড্রিনালিন কি করবে ওই ব্লিডিং আটকাতে আটকাতে হার্ট ফেল করে যাবে উপরে ইউ আর গোইং টু গেট সো মাচ sympathetic stimulation that she is going to go into cardiac compromise then thrombolytic agent sorry what is that used for what is altiplase used for breaking the clot for breaking the clot if you break the clot you are going to give more bleeding है ना so এত confusion হয়ে গেল we must have drugs to control bleeding right what was the drug why does nobody remember tranexamic acid tranexamic acid antifibrinolytic no what was the coagulation pathway combined pathway fine কি হয় pathway শেষে গিয়ে কি হয় what is the last step of the pathway fibrin আচ্ছা fibrinটাকে ডিসোলিউট করে to remove the clot right if you give a drug to stop this removal of fibrinogen fibrin রিমুভ করার যদি মানে রিমুভ করার প্রসিডিউরটাকে আমরা আটকাই অ্যান্টি ফিব্রিনোলাইটিক মানে ফিব্রিনোলাইসিসটাকে আমরা আটকাচ্ছি ফিব্রিন দিয়ে ক্লট করেছে ফিব্রিনোলাইসিস ক্লটটাকে সরাচ্ছে এই সরানোর প্রসিডিউরটাকে আটকালে তাহলে ব্লিডিং আটকাবে why has nobody has heard of tranexamic acid strange so we have a drug called tranexamic acid antifibrinolytic agent okay that is what we can give for stopping the bleeding that is a generalized drug anywhere in the body anybody is bleeding you are going to give her or him tranexamic acid comes in the very general name of PAUS PAUSE PAUS injections obstetrics we have some drugs known as uterotonics normally আমাদের ডেলিভারির পরে বা সিজারিয়ানের পরে how does the bleeding stop by oxytocin oxytocin is a hormone comes from the posterior pituitary it stimulates uterine contraction once the uterus contracts what happens uterus contract করলে bleeding বন্ধ হবে there is a crisscross networks of musculature in the uterus তার ভিতর দিয়ে blood vessels cross করে if it contracts it stops the blood vessels from bleeding natural mechanism to control the bleeding after delivery we are going to augment that by giving oxytocin or drugs which are similar to oxytocin known as oxytocics which are similar to oxytocin or they are also known as uterotonics increasing the tone and the contraction of the uterus we have a very methyl ergometry pharmaতে ছিল এটা oxytocic and uterotonics were there in pharma you read of syntocinon you have read of ergometry you have read of carboprost है कि नहीं हाँ you have read of those right these are uterotonics they increase the tone of the uterus and stop the bleeding so we are going to give an injection known as methergin or methyl ergometry it causes uterine contraction and stops the bleeding okay বেশ bleeding বন্ধ হলো কি বলছিলাম আমরা hemorrhage any other complications may get into shock very good if it is bleeding too much there are two kinds of shocks that can occur number one is a hemorrhagic shock or hypovolemic shock which occurs if she is bleeding profusely you have not stopped the bleeding you have been unable to diagnose the bleeding she has gone into shock what is the other kind of shock that can occur septic shock can occur but takes time septic shock is not an immediate phenomenon it occurs there is infection, there will be sepsis hote sepsis will become septicemia, runs throughout the body, then she goes into septic shock. It will take 2 to 3 days time. During the procedure কি হতে পারে, আরেকটা কি shock হতে পারে? No, neurogenic shock. When you are dilating the cervix has multiple nerve endings. So when you are dilating the cervix, it causes a sudden vasospasm and it can cause a neurogenic shock. Okay. Anaphylaxis hote pare. When you are giving drugs, the drugs may cause anaphylaxis. We are not, that can occur any time for any person. We are not really concerned about that anymore. Okay. Shock. What else? RP complication hote pare? Sepsis. Take a infection, sepsis holo আর কিছু? Sorry? You're not cutting anything. Surgical site কোথায়? কোথাও কাটার কোনো ইনস্ট্রুমেন্ট দেখলি এখানে? No. কোথা থেকে ইনফেকশন? সার্জিক্যাল সাইট ইনফেকশন. What else? Very dreaded complication is known as a perforation. You are doing it blindly. Now you cannot see where you are going. It's a closed box, the uterus. You are going blindly inside with a dilator, with a sound, with a curette, with a ovum. You might perforate the uterus. ফুটো করে দিল ইউট্রাসটাকে, ইউট্রাসের ওয়ালটা ফুটো হয়ে গেল, চলে ভিতরে চলে গেল। ভিতরে কোথায় যাবি? ইউট্রাস ফুটো হলো, তারপর কোথায় যাবে ইনস্ট্রুমেন্ট? ইনসাইড দ্য পেরিটোনিয়াল ক্যাভিটি। হোয়াট ইজ দ্যাট ইনসাইড দ্য পেরিটোনিয়াল ক্যাভিটি? সব জায়গায় ঘুরে বেড়াচ্ছে, কি ঘুরে বেড়াচ্ছে? Intestine. So you might catch hold of a loop of intestine and bring it through the cavity. We have seen patients going to walks or going to some এদিক ওদিক থেকে, they have done a dilatation curettage, they have done dilatation evacuation outside, not in a proper hospital setup, come back to us in a hospital setup with loops of intestine coming out through the vagina. এমন অবস্থা। They unknowingly they have perforated the uterus, they have brought down loops of intestine. Now they don't know what to do. You cannot put it back inside. It's not possible to put it back inside. So she has come to us in that state. So you have to be very gentle with your instruments always. Whenever you get the chance, if you get the chance of doing something like this, be very gentle with your instruments. Always use a sound to understand the length and the position of the uterus. Do a per vaginal bimanual examination to know the length of the uterus much better. Then insert this sound. Then you go with instruments. Okay, so that you do not perforate. Okay. Perforation হলো পেশেন্ট শকে ব্লিডিং হতে পারে, ইন্ট্রা-অ্যাবডোমিনাল ব্লিডিং হতে পারে, ইউট্রাস ফুটো হয়েছে, পেটের মধ্যে ব্লিডিং হচ্ছে, নিচ দিয়ে ব্লিডিং হবে, she might again land into shock. Perforation is suspect. How, first of all, how will you suspect the perforation হয়েছে? কি করে বুঝবো আমি perforation হয়েছে? আমি ইনিশিয়ালি যখন করছিলাম, suppose this much of the instrument was inside the uterus, এতটা যাচ্ছিল, suddenly I feel a loss of resistance. Initially there are resistance ছিল, ইউট্রাসের ফান্ডাসটা উপরে আছে, you are hitting the fundus, you are touching the fundus, there is a resistance there. Suddenly there is a loss of resistance. Your instrument is going inside more than it should have. You stop your procedure there. You understand that you have perforated the uterus, you stop the procedure. Okay? And you go for a laparotomy. You open the abdomen, you repair the rent. Perforation. Okay? Perforation এর সাথে কি বললাম? Gut injury হতে পারে, sigmoid injury হতে পারে, loop of intestine can come out, you can go into sepsis again with that problems. Right? আরো কিছু হতে পারে, forceful dilatation. Dilator ঢুকছে না, but you are forcing it to go inside. Forceful dilatation করছি আমরা, তখনও রাপচার হতে পারে। জোরে করছি, suddenly loss of resistance goes inside. So in order to avoid the forceful dilatation, what do? We soften the cervix by some drugs before going for dilatation. কি দিয়ে সফট করবো সার্ভিক্সটাকে? You have heard of the drug called misoprostol? Misoprostol. You give the misoprostol tablet per vaginally, 2 to 3 tablets, 3 to 4 hours before your surgery. Misoprostol is a very unique drug, very unique tablet. It is absorbed almost through anywhere in the body. আমরা নর্মালি ট্যাবলেট কি বুঝি? জল দিয়ে গিলতে হয় ট্যাবলেট, তাই তো? Misoprostol is very unique. It can be absorbed from anywhere in the body. Sublingual route, buccal route, oral route, per rectal route, per vaginal route. can be given anywhere. So we use this misoprostol tablet per vaginally 3 to 4 hours before our surgery. Helps to soften the cervix so that dilatation is not forceful. It can occur smoothly. Right? We are almost done. Well, any questions? We are done with the teaching.